press this, let's go. There's my face. We'll go up here. Okay, so this is just a video presentation to discuss a topic that is mentioned quite a lot in memes and also generally speaking when it comes to RP training and powerlifting. So I think it's people probably understand it conceptually, but I'm not entirely sure people understand how it fits into um, the wider picture as it comes to program delivery, program design, and then the results that we actually get when we perform the program. So just if we understand some of the background concepts to how we put together training cycles and what that means when we overstep what is prescribed in terms of either percentage or in terms of RPE effort, what effect that has on the program and ultimately your trajectory on that program. I think some understanding behind that would be useful for people. So this could be a good one if you don't have much understanding behind kind of the basic concepts behind program design. And now I need to press next slide. Okay, so the first slide we're going to look at here is the basic concept which most program design is based on. So this is general adaptation syndrome described by Hans Seal in the 1950s, and it's very basic. It's not really a theory. It's more just of a general concept. So basically, an organic system or a biological system, such as a person or a dog or whatever, or a plant, is placed under a specific environmental stressor. So in our case, that environmental stressor is exercise-induced stress, and more specifically, exercise-induced stress via weight, load, strength training. The stressor occurs immediately after that stress. The organism is less able to respond to that stress. So 2 hours, 4 hours, 8 hours after a workout, your performance will be reduced. But with enough time allotted, the body will start to develop a resistance to that stress. So in the terms of strength training, that resistance is an increase in strength or an increase in fitness towards strength training or strength stress. And after enough time, if the stress is continually applied with no respite, the organism will eventually enter an exhaustion phase. So in our case, that exhaustion phase would be overtraining and injury. So this was then advanced by Soviet sports scientists. I think this was first produced in the 1970s. So this is a super compensation model. So basically it says we have a baseline of fitness. So maybe, let's say, we'll put this into numbers. Let's say you have the capacity to bench press 100 kilos. You then do a training session that is stressful. Immediately after and during the recovery from that strength training bout or that session, your bench press capacity could be 85 or 90 kilos. Then with enough time after the recovery has happened, we then get this increase in fitness. So maybe it goes to 101, 102, 103 kilos. And this is a finite increase. So maybe we only increase our strength for maybe 2 weeks or 3 weeks post-bout. And if we don't engage in another stressful bout of training, we fall back to our baseline, and then without any stress stimulus, we then fall away from the baseline because there's nothing to keep that level of strength or that level of fitness. If the body doesn't have a reason to create and maintain adaptations, it will lose them because the body doesn't produce. So for an example thereof, when we get stronger strength training, we create more muscle mass. Your body will get rid of muscle mass it doesn't need. So if you have larger quads, because you squat a lot, if you stop squatting, your body will start to atrophy those quads. If you're only walking, you're not going to keep the size of your legs. And there's also neural pathways involved. So the skill side or the neuromuscular side, the more we use pathways and the more we do skills, the more we develop skills, the larger the bandwidth, the connections in the brain for those movements or for those skills. And likewise, if we don't use them, the bandwidth reduces. So you have the what's called muscle memory, where if you've done weight training before, or you've done a skill before, you don't lose everything. So if you say you're a good squatter and you stop squatting for 3 or 4 years, when you come back to squatting, you will gain adaptation faster than someone who is a novice because you have those adaptations are dormant or they've been lost over time, but not everything's been lost over time. So that's two mechanisms through which you could lose adaptation without stress. And then we have fitness fatigue theory. This was proposed in the 80s or the 90s in a European conference. I can't remember the exact dates thereof. If you want to get specifics, you can just Google fitness fatigue theory. So this is basically the same as supercompensation theory, but it also brings in fatigue. So this basically shows that after a training bout, fatigue is higher. So as fatigue's higher, performance can't be higher. So after you engage in a training bout, your fitness will increase. But while fatigue is high, performance cannot be high. So there's a period after training where performance is maximized. So this might not be your maximum point of fitness. So you may have been capable of bench pressing, squatting, deadlifting more here, but fatigue is too high, so you can't express that. So with time, as fatigue falls away, there's a point in time where your potential is greatest, and your potential is performance. You may have capability to do more, but if you're under fatigue, you can't show that performance. You can't actually do what you're capable of without fatigue being dropped, and this is where tapers come from. So this is fitness fatigue theory. And when we put together training blocks, so when we do training sessions, training weeks, so we do training sessions within a week, there's going to be, so if we do a heavy squat session on Monday, we know we're not going to be able to produce an optimal stimulus on Tuesday or even Wednesday for a squat, less so for deadlift, but for lower body, if we do a heavy effort on a lower body on day one, plus 24 hours, probably not going to be capable of producing an optimal performance. Plus 48, we could probably produce a pretty good performance. Plus 72, we're probably going to be ready to go again in terms of a heavy load. But there's also, if there's 5 training bouts over the week, there's an accrue of fatigue over that time. And if we're loading systematically over week 1, 2, 3, 4, 5, there's going to be fatigue building up over those weeks. So that fatigue is from those training bouts. So while fatigue is high, maybe in week 6, so if we do 5 overload weeks in a row, maybe on week 6 we could potentially lift more than on week 5. However, fatigue is raised to a level where we can't express that. And if we start to load on week 6, we start to enter overreach and then overloading, overtraining. So overload and progressive overload. So when we talk about session to session, so this is an acute thing. An overload basically means that your training is providing a stress above and beyond that which you have encountered in previous training bouts. This is only really relevant on a kind of weekly time frame. So week 1, 2, and 3, maybe 4. As training history goes into the past, it becomes less relevant. So anything you've done like 8 to 12 weeks ago, it may have conferred benefit over the training cycles if it's been structured in a way. But if you've done a block of 10s, 4 weeks of 10s, or 8s, or higher volume muscular endurance based work, by the time you're on block 2, maybe plus 6, plus 8 weeks, the strength endurance that you've gained from that has dissipated pretty much. So when you look at training overload or you look at stress, you're probably better 2 to 3 week window. You're probably better off having a 2 to 3 week window from which to look into it, because as training becomes history, it becomes irrelevant. So that's kind of overload basically within that kind of finite. An overload is a finite stress load which is greater than that which has preceded it within a relevant time frame, is basically what I'm trying to say. Progressive overload means you systematically do that or systemically do that. Every workout has something that's overloading, or it's in there for a reason. It doesn't necessarily have to produce a volume overload. It doesn't necessarily have to produce like a a stress over or a load, like an intensity overload, and it doesn't necessarily have to be a volume and intensity overload. It can be a frequency overload. It can be a skill based overload. It can be there are more than one ways to stress movement. So there's more than one way to stress things or the biological systems in training. So you can be creative with how you do this. That's how, yeah. So basically, just saying point 3. It's only one lever we can use. One lever, strong spelling. It's one lever we can use to help progress somebody. Overload and progressive overload aren't the only ways to progress. They're just the hammer. They're the blunt tool that everyone can understand, grasp, and use to create adaptation and fitness gain in people. So overreach. So this is a period. So when we're producing overload, but we're deliberately, or maybe the stress is deliberately higher than we can recover from on a session to session, week on week basis, and this will create more stress. So if you overreach, you will show an acute loss in performance. So if you're doing an overreach squat program, the silly and well-known version of which is the Smolov base cycle, your squat performance might actually dip for a while. So if you do the base cycles 3 weeks, your 1RM might actually drop week 3, week 4, week 5, but with sufficient taper, you'll see a massive bounce in performance. So you might, let's say you do the Smolov base cycle, which is a 4-day a week program with like large volumes. So it's 4x9, 65%, 5x7, 70%, 7x5, I'm 5% down. 4x9 at 70%, 5x7, 75%, 7x5, 80%, and then 10x3 at 85%. That's 1 week's worth of training, so that's a huge volume load, huge intensity, just massive training load for the week. And then for 3 weeks you had 10 kilos the first week, and then you had 5 kilos the second week, or it might even be 15 and 10, I can't remember. But there's an arbitrary load added onto that. So you're basically getting squatted to death for 3 weeks. And then at the end of those 3 weeks, if you haven't picked up an injury, then you do a taper. So you might take like one easy week or 2 easy weeks, and then go to do a squat max. And when you take the taper, you're basically overreaching for 3 weeks. After a taper or a recovery of 1 week, 2 weeks, where we reduce training stress, reduce frequency, reduce load, and then we either ramp to 1RM over 1 or 2 weeks, or we perform just a 1RM testing session. If you haven't got injured, you'll realize a large gain in performance, or a large gain in fitness, or a large gain in your squat. So you could put 20 kilos, 30 kilos, 40 kilos on your squat. The Smolov, if you survive it, produces like ridiculous outcomes. However, you don't maintain that fitness. You do not maintain that squat max, because as we see in the fitness fatigue theory, while fatigue is high, so on week 3, at the end of week 3, fatigue is massively high, so we can't actually, although we might be able to squat a fuckload more than we could have done on week 1, because fatigue is so elevated, we can actually produce that performance, we can actually show that performance. So that means with enough time, enough recovery, performance increases, but fitness or capability might actually have reduced from where it was. Maybe on week 3 we could have done 60 kilos more if fatigue wasn't so high, but because fatigue was so high we couldn't show it. So by dropping off the training volume, training intensity, training frequency, we allow fatigue to dissipate or to go down, and while fatigue is down, performance can be temporarily high. So there's a point in time where there is an optimal performance, and that's where the basis for tapers comes from. So when you hear a peaking cycle, this is what we're talking about. We're talking about deliberately overloading and overreaching you, and then reducing the training stress. So come competition, you should be in a position where for a finite period of time you can produce a performance that you couldn't produce without the overload, the recovery, for fuck's sake, the recovery and then the ultimate performance. This is going to end up being fucking 30 minutes. But fuck it. So overtraining is basically this concept of overreach applied without the recovery. So if someone is systemically overloading every workout without recovery, so without deload weeks, without lighter training sessions, without light weeks, eventually they will start entering a negative spiral, or a death spiral. They will start, basically, they'll stop recovering from workouts, so performance session to session will become worse. They start to become chronically sore, chronically tired. They basically just dig a hole. They can become psychologically repressed, stressed, can't sleep properly, appetite goes to shit. Overtraining syndrome is documented in literature if you want to look at it, and that's what overtraining is. Basically, this is someone who goes heavy all the time, or goes hard all the time, and never gives themselves a chance to recover. They end up with worse performance, suppressed appetite, suppressed mood, suppressed ability to recover. They can't sleep as well, can't eat as well. Inflamed, sore. It's just a shit place to be. So if you constantly train too hard and don't allow for recovery, this is where you end up, and you also will get injured eventually doing this. It's not a matter of if, it's when. You can probably say that generally with training. So if you're training to become better at something, you're probably going to get injured at some stage, because load will exceed your ability to recover from training eventually. Or you'll just get injured in competition. Happens, acute injuries happen. So if you're training to get better, you're probably going to get injured. It's a question of if, not when. But if you overtrain, you are exponentially increasing the chances of that. And we'll cover that in a slide, probably a slide a bit over. So deliberately or functional overreach, we've already spoke about. It's basically we're training where the athlete is deliberately overloaded for a finite period of time. So an important competition, you might do an 8-week, say, 4 weeks of accumulation, 4 weeks of realization. So that's the example where we deliberately overload one aspect, the volume of the program, and then we systematically reduce the volume load and increase the intensity. And then we pull away for a week for extra recovery, and then at the end of that, if everything's went well, we've made all of our accumulation workouts, we made all our intensification workouts, and then we have a recovery period. At the end of that, we should be able to produce performance above that of which the training was. We basically train hard without sufficient recovery until training starts to suffer. Then we pull back, allows for sufficient recovery. That pullback, that sufficient recovery, allows for fatigue to drop. Fatigue drops, performance is high for a finite period of time, and that's the peak. That's what we do when we do a peaking cycle. Blah, blah, blah. So here's one study. You could find more studies if you want. But basically the effect of training to failure on recovery. So 2 groups, one did 3x10 to failure, and then the other group did 6x5, not to failure. So RPE 5 in the tank. Say if you do 3x10 with a 10 RM, and then 6x5, same total volume, but with 5 reps in the tank, so RPE 5. They then measured neuromuscular measures of strength and performance, namely counter movement jump and velocity, bar velocity at 75% of 1 rep max for bench press and squat. And they showed that the 3x10 group, or the 3x, what was that, sorry? Anyway, the failure group, the 3x10, sorry, I can't read. The 3x5 and the 6x5 experiments. So this is obviously the control group. This is the experimental group with the same volume. They recover significantly faster after 24 and 48 hours post exercise, whereas the 3x10 also had markers of acute fatigue, ammonia, growth hormone, and delayed creatine kinase, which is an inflammation marker that they use in bloods. They were markedly elevated over the 48-hour. So their performance tests were down, and markers of inflammation and markers of fatigue were higher in blood work than the 3x5 and 6x5 groups. So they showed that training to failure decreases performance after 24 and 48 hours, and also increases markers of inflammation and exercise fatigue. So if you train to failure, you take longer to recover, which I think we all probably know. There's a fuckload of research on it if you want to check it. This is something that I've just made up. So this is AU, so arbitrary stress, the proximity to failure and effects on fatigue is what I've titled it. So RP 5, 6, 7, 8, 9, 10, and then arbitrary units of stress. So you can see 5 is not really producing any form of stress or any form of adaptation. 6, we start to produce some adaptation. 7, we produce some adaptation. 8, adaptation or stress is higher. And then 9 to 10, we see big jumps, exponential jumps in the amount of fatigue. So 10 is basically training to failure. Maybe not going to concentric failure, but even getting 1, you could even say the failure is maybe up here. So the closer we are to maximal effort, the greater the stress produced by that workout, and it climbs up sharply between 2 reps in reserve, 1 rep in reserve, no reps in reserve, and failure. So in strength training, when we're only really worried about the performance, training to failure needs to be done with care and for a reason. It's not something that we should be doing on competition lifts a lot, arguably at all, because we will overreach at some stage. We will overreach some stage. So, overshooting in context of a training block. This is brought to you by MS Paint. So this is time and weeks over a block, and this green, everyone. So we have a workout, reduction in performance, recovery is allowed, workout, and we have this ramp up to where we basically hit the end of our ability to recover from the training stress or the mesocycle we're producing, so the block of training. Eventually, if we're systemically overloading something, eventually we run out of roadway where we can recover from that stress, and that is basically where we then take the deload. So when we perform 5 weeks, 6 weeks, 7 weeks, 8 weeks of the same program, if we're continually getting better at that training block, probably shouldn't change anything, probably leave it. And there's even data that the reactive training system guys show that there's different kinds of recoveries. So you can have maybe people who improve up to week 4 and then have a drop off in week 5, but then have a bounce on week 6, so they can run a 6-week block where on week 5 they expect a dip in recovery, but they continue on because in week 6 they have a bounce in their performance, and then after week 7, week 8, week 9 they have a drop off, and that's when they take a deload. So that's part of the emergency strategies where they determine what kind of response the athlete has. They then design programs around that response. So rather than doing a peak and cycle where we say like we have 8 weeks where we overload for 4, taper for 5, and then compete, they'll just look to compete on week 6. So if you're a responder where you improve for 4 weeks, you then have a drop off on week 5, and then in week 6, that's your best week. They'll try and bring that into your planning so that you're competing on your peak, what they call it their peak week, and they call it time to peak. And then this red is someone who overshoots, so they might get better faster because they're producing more training stimulus. And as they recover from that larger training stimulus, they'll see faster progression in estimated RM, but they'll drop off a cliff eventually when they overreach. And then if they're constantly overshooting, constantly providing more stress than was planned, they'll basically over the course of a training block, 2 training blocks, 3 training blocks, training year, and the longer this effect goes, the longer the person who produces enough or sufficient training stimulus will outperform the person who overshoots or produces too much training stimulus. And this is why going heavier than suggested in a program isn't wise. On a once-off, fine. Like if you're feeling amazing and you take like a massive PB, okay. If that's what you do once in a while, because you don't feel amazing every workout. So if you feel especially good one workout and use it to produce a personal best performance, I mean, most people would be okay with that. But where you're constantly doing more or constantly doing as much as you can each session, this is what it leads to. It leads to underperformance, and it also leads to increased danger of injury. So this is less applicable to lifting, but it's a good visual aid. So this is Tim Gabbett's work, and it's based off GPS data and team sports. So basically, your acute to chronic work ratio is based off what you've done 3 weeks previously. So if you have an average of 5,000 kilometers of GPS, if you keep it the same, plus minus, so like 80% or 120%, your chance of injury is greatly reduced versus if you under train or overtrain. But where you overtrain, so we do twice the work, we start to see this almost exponential increase. So like, 4 or 5x depending on where you're at. So if you have a 5% chance of injury here, over here you have a 15 to 20% chance of injury. So you're talking, or no, maybe not, or is a magnitude exponential, like fuck, who knows. I think exponential is 10x, it's not 10x. But you have times, so like 2 or 3 times or 4 times increased risk of injury if your chronic workload is constantly higher. So in the context of lifting, if your chronic load or your RPEs are constantly higher, this is where you're in, because basically you basically enter into overtraining, cyclically overreaching, cyclically overloading without allowing sufficient recovery. And let's say if we both start from the same starting point, as we showed in the previous slide, you'll end up getting a better result over 3 or 4 weeks or 3 or 4 sessions. But eventually your ability to recover will be diminished because your stress will outstrip your ability to recover. And then your training loads you'll start to feel sore, your performance will start to dip, and you won't be able to keep up the ability to recover and outperform or overload each session. And then you just end up in like a negative feedback loop where you'll either get injured or you'll eventually take a deload because you'll just be too fucked and you'll realize actually this is no good. But if you're someone who doesn't recognize that this is not necessarily a good trajectory and don't take the necessary steps of reducing training load, volume, intensity, deloading basically, you're either going to burn out or get injured. So to finish, it's going to be a 30-minute video. I thought it'd be like a fucking 10-minute video anyway. Overshooting leads to faster gains at 1 rep max performance. We talked about faster overreach. You're more likely to be exposed to overtraining without sufficient deload. You're exponentially more likely to encounter an injury event. Exponentially is probably not right, but you are markedly increased chance, 2x, 3x, 4x more likely to get injured due to more load accumulation without sufficient recovery. Eventually, your load will surpass your tissue's ability to recover, and you will get injured, and you will underperform in terms of 1 rep max, strength gain, fitness gain over a long period of time over someone who follows the goddamn program. Okay, thank you very much for watching. Hopefully this makes sense, and you follow your RPEs and your loads as you're intended, so that you then get the performance that we all want. Coaches want you to get stronger. Your coach wants you to get stronger because it's good for them. Getting stronger, getting better is beneficial for everybody. The short-term gratification of a good session where you set PBs is fantastic, and like as previously discussed, if you're feeling fucking amazing, take it with both hands. But don't be a greedy cunt. Don't constantly take with both hands. You gotta take and give. So follow the goddamn program. Fucking eat your Wheaties. Dot your I's, cross your T's, clean your goddamn room. Thank you very much for watching. We'll see you in the next one. Goodbye.